My name is Laura Welborn. I'm a nurse practitioner here at Kansas Medical Clinic. Today I'm going to discuss hepatitis C. Hepatitis C is a virus that affects the liver, causing long-term effects. Hepatitis C affects more than 3 million people in the U.S. Many affected people don't even know they have the virus. 85% of patients with acute hepatitis C will go on to develop chronic hepatitis C. What is the difference between acute hepatitis C and chronic hepatitis C? Acute hepatitis C is when the virus is initially exposed to someone. Chronic hepatitis C is when the virus is present for more than 6 months. When the hepatitis C virus infects a healthy liver, the virus can be cleared spontaneously or go away without treatment, or patients will go on to develop chronic hepatitis C. Once the virus infects the liver, inflammation occurs, and eventually scarring or fibrosis occurs. As time goes on, and if the virus is untreated, the scarring will worsen and eventually cause cirrhosis, liver failure, and hepatocellular carcinoma or liver cancer. The goal for treatment is to prevent progression leading to advanced liver disease. What are the symptoms of acute hepatitis C? Fever, headache, body aches, jaundice or yellowing of the skin, or flu-like symptoms. Many people don't even know they are infected because symptoms can range from mild to severe. These symptoms can occur 2 weeks to 6 months after exposure. How is the virus transmitted? Hepatitis C is transmitted from direct blood-to-blood contact. Exposure of blood to mucous membranes can result in infection, however, is less likely. Hepatitis C can be detected in saliva, semen, breast milk, and other body fluids, and again is a less likely mode of transmission. What are the risk factors? Healthcare workers who have been exposed to infected blood due to needle sticks or body fluids, history of IV drug use or inhaled illicit drug use. Increased opioid use in the past several years has increased the incidence. History of HIV, history of piercings or tattoos in an informal setting or with non-sterile equipment. History of hemodialysis, blood transfusion, organ transplant before 1992. Born to a woman with history of hepatitis C infection, or baby boomers. This is the population born between 1945 and 1965. What are the complications of hepatitis C? Complications of hepatitis C can include scarring of the liver, which can lead to cirrhosis, liver cancer, liver failure, and death. If left untreated, chronic hepatitis C can cause progressive liver damage. 20 to 30% of individuals with untreated hepatitis C develop cirrhosis within 25 to 30 years of acquiring the infection. Hepatitis C is diagnosed through labs. Hepatitis panel, which includes the hepatitis C antibody. This lab tells us if a patient has been exposed to the virus. Additional labs will include complete blood count, comprehensive panel, HCV RNA. This is the lab that determines if a patient has chronic hepatitis C, genotype, hepatitis B surface antigen, and HIV. Imaging includes ultrasound, FibroScan, and/or liver biopsy will determine the amount of scarring or fibrosis. A fiber scan is a non-invasive test to determine the stiffness of the liver. The more scarring in the liver, the more stiffness is seen. This suggests fibrosis. The fiber scan test is done in our office. What are the medications? Antiviral medications are recommended for treatment. Mavorite, Epclusa, and Harvoni are the most common drugs used. Ribavirin is used in combination for decompensated cirrhosis. All drugs are oral medications. Insurances will determine which drug is used. Treatment is usually 8 to 12 weeks, depending on the medication and the severity of fibrosis. While on treatment, HCV RNA, complete blood count, comprehensive panel are done at 1 month after starting treatment. Treatment response rates range from 90 to 100%. What are the follow-up labs? Follow-up labs include HCV RNA 3 months after treatment. If this lab is non-detected, this means the virus is gone or cured. Once the patient has been exposed to the virus, the hepatitis C antibody will always be positive. There is no need for follow-up labs. If the patient has cirrhosis, they will need routine labs and ultrasound every 6 months. We at Kansas Medical Clinic can treat hepatitis C. Please call us at 785-354-8518 or visit our website at kmcpa.com for any questions regarding treatment options, fiber scan, or to discuss hepatitis C.